So if pain is communication, can therapy, or is therapy sometimes more effective than medication? It's a good question. I'm very holistic, and by that I mean also that we need to include the importance of medication. I'm not one of these people that feels that it should be all pharmacological or all non-pharmacological. I think there's a place for everything, and really good medicine and good healthcare, I think, is about understanding what is the right combination for that individual at this moment in time, yeah, and what are the most effective ways, and if some of those are better dealt with without pharmacology and the side effects and risks, then let's do that. But what about pain? Well, painkillers are great. We've probably all taken a paracetamol with, headaches or pains, etc., and that's valid. But if we just suppress pain, then sometimes, we are just pushing down that communication. And very often I use this expression that, it's a bit like when the children, if you have children and they were tiny and they wake up in the morning and they go, "Oh, mummy, I don't feel very well, my tummy hurts." And you're like, "Oh," you're stressed out and you're thinking, "Oh gosh, I've got to go to work, and they're probably just trying to get a day off school and and haven't got time for this," and you rush them on and you shovel them in the car, and then they keep going like, "It really hurts," and you're not listening, and then you sort of drop them at school and think, "Oh, right, okay, good, that's that done." And then at 2 o'clock in the afternoon you get a phone call and say, little Johnny's been sick and is really unwell, and they were trying to tell you, early on, but we didn't listen, and so what it does is it shouts louder. And I think that's a sort of a nice metaphor for the pain in our bodies. If we listen, and in my journey, I'm much, much better at listening constantly to my being, and listening not in a paranoia, but in a way that I'm connected to my being, and I go, okay, that I'm aware of that. What is it trying to tell me? Now, if that's overwhelming, there is a place for painkillers, because of course, if we're in so much pain, or if that is an inflammatory thing and we go, okay, we've understood what the nature of the problem is, let me take some painkillers. If that is going to dampen down the pain, perhaps mean that I get less signal to my perhaps already upregulated sensory cortex, maybe get a better night's sleep, which of course is important in healing and so on. So there is a place for it. But what I think is important is that we just go, oh, there's pain, let me get rid of it, and this will get rid of it, and I'll stop taking the painkillers in a couple of days, and oh, guess what? The pain's gone away. Oh, it must be fine then. If we don't really know what the origin of that is, it will tend to come back, or it might come back in a different place, and this is where we start to develop into chronic pain patterns, or maybe fibromyalgia, or if we're not seeing that pain, if we're assuming that it is always something, as a tissue trauma, as opposed to perhaps a somatic signaling of emotional overwhelm, then, we're not listening to it. And so it's going to just keep ramping up until we get more and more sick. Yeah. And so I think there is a place for pharmacology and analgesics. Of course there is. But I think it's about judicious use of those, and being able to realize that pain is communication might help us to actually tune in and listen, rather than go, it's a pain, it's inconvenient, let me obliterate it. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.